Melanie from Croaky here at the Oceania Tobacco Control Conference in Hobart, and I'm here with Mel, who's come a long way to be here. Mel, would you so kindly introduce yourself?
I'm Melanie Herdman. I'm the coordinator of the Tackling Indigenous Smoking program in Nhulunbuy, and we service about 15,000 people in the public health sector.
Now, you stood up on the first day and asked a question. Can you repeat it for us?
So my question was about how we get our story out nationally about the statistics in our communities around the smoking rates and the stories of success and challenges that we face in remote communities. Because when the presentation was being delivered to us, it didn't include us.
What's your worry about that, about not being part of those discussions?
Well, one of the facts are that remote, we all know, and it's been mentioned a lot throughout the sessions, that remote Australia is one of the highest rates of, having people, and especially Indigenous people, who smoke, and those stories aren't being captured at a national level. So when we come here and we're talking about, the states and how they've improved, we're not actually capturing the whole territories and states of Australia. We're excluding the stories of where smoking is actually higher.
So let's stop that right now.
Yeah.
And can you tell us the story about your community and what your big challenges are, and what you're doing?
So the story of my community is that we do have a high number of our people, our Yolngu people, that are smoking. And I guess the story that I want to get out is that, Ray Lovett talked about it this morning. He said that there is not enough data and research being done out in the remote communities. We are doing that stuff. We are collecting the data. We know our communities. All we need is that support to get those stories out, whether it's collecting the data and applying it to our national statistics, getting our stories out there of what's been successful on how we've supported our communities to reduce the number of smokers, but also the fact that, we aren't included in those national statistics. We want to be included. So how, my community, we're all for it. We can do it. And it's just a matter of, working with other people to get that story out there.
What are some of the challenges, and Tom Kalmer said for me to ask you some of the challenges around the geographical area? We're just being buzzed in for the next session. It's not Christmas. The geographical
we have
issues and language issues.
Yes, so yesterday one of our community members, one of my community workers stood up, Oscar Garocha, and he talked about, he wanted to increase the number of TIS workers in his community, because his community is 5,000, a population of 5,000. So he sees that an issue in his community is the workforce. And I'm happy to work with him on that. But again, it's the funding that we've got. We need to make sure that we're applying it evenly throughout, whether it's activities to the workforce, employment, and other resources that we might need. One of our issues is that some communities you can't actually get a plane to. So having the resources available to actually go out to people, go out to community. Our work is outreach, it's not clinical, so we need to get out to communities to deliver education, to do activities, to raise the awareness and support our community.
So what do you need to do that? More funding? What is it? What will be the breakthrough for you?
I don't like to say it, but more flexibility on what we can spend on our capital assets. Capital assets is a big issue for us in remote Australia.
What do you mean by that?
Offices, vehicles to enable us to drive out to our communities, being able, being able to see the big picture and showing my team that this is how we can do it, this is how we can get there. So, and working with researchers and working with other organisations so that that data is being collected so they actually know what our challenges are. Because unless people work with us and see how we work and see our challenges, they won't know.
Is there a story from your community of efforts that you've made that you would really like to highlight about either what works or what are the big challenges?
Yeah. So we created a couple of years ago the tobacco story. It's a DVD, and that shows you the story, the history behind tobacco. It talks about what we are doing now. It talks about how we can help you. One of the challenges that I see is that we need to engage with our community as a service, but also as a family member. So it is a bonus, but sometimes it can be challenges, because then that restricts the level of information that we share, and it's, gender-based and all of those challenges. We know how to work on that. I guess one of the things that that is constantly a challenge for me is that we often have to operate in the Western world, and I try and be inclusive of our culture as much as I do of our Western knowledge and understanding and data collection and all of that. So that's my challenge, is getting a team that is, I guess, functioning in both worlds, our world, our Yolngu world, applying language and culture and kinship and relation and all of that stuff, and at the same time collecting data, making reports, making sure that we're ticking our boxes and using our funding appropriately, and putting that together is a challenge.
So what would you like to see emerge out of a conference like this to assist remote communities like yours?
Well, I've taken a lot away. I am going to be taking a lot away from this conference. Most of it I've already heard before. It's just about how do I apply it to our remote communities. And I guess some of the things that I think needs to be achieved for remote community to be included into statistics is researchers, putting out their hands and coming out and working with us, seeing, and applying, I guess, the stories that we know, what's best for our community, what our challenges are, and how we're actually working in these remote communities that often take a whole day to travel there, do a 3-hour education session and then a 4-hour drive back into town. I want that story to get out. So I think to make sure that our story gets out, we need the research, we need the data, and we need to be able to use that data to show the rest of Australia that we do matter in terms of statistics.
Thank you so very, very much, Mel.